And also give them the words, because a lot of times, 5, 6, 7-year-olds don't even have the words to express the things that have happened to them. And so through the play, they're able to do that. They're actually healing through the play itself.
Hello, welcome to RecoveryTV Live. We just finished filming a great episode where we talked about children and recovery, and we're going to have more on that coming up, so don't go anywhere. Thanks for tuning in to RecoveryTV Live. My name is Josh Nichols. I'm one of the co-hosts of RecoveryTV Live. And before we cut to the clip, let me tell you a little bit about our guest. Nancy Soliz is a licensed marital and family therapist and registered play therapist. She also is a co-founder and co-owner of the Oklahoma Play Therapy Training Institute. She's trained in eye movement desensitization and reprocessing, and as if that is not enough, she also owns and operates a private practice where she works with children and families using play therapy as her primary tool for treatment. So in other words, she knows what she's doing, and she's extremely well versed in treating children through the form of play. So without further ado, let's cut to the segment.
Play is a natural medium for kids, throughout the world. Kids don't have to learn how to play. Like no matter if you go to any country in the world, kids are playing. So it's just harnessing that natural, innate ability in children to use it towards healing. Oftentimes I'll talk to parents about what does their child's play look like, because you're really getting insight into that child's world. The more that you play with them and just watch their play, so you can really kind of get to know your child better. You can kind of see what's on their mind. Children experience the world around them differently. Adults are able to make different choices that children don't have. Kids oftentimes that are experiencing trauma don't have the choice, especially if they have trauma inflicted on them in their home environment. Also, just looking at child development, children are at a different place developmentally than adults. Adults are able to think about things in different ways that children just don't have the capabilities yet to process through things in the same way that adults would. Kids oftentimes don't have the words that adults have. An adult can say, this negatively impacted me, and this is the reasons why, and this is the way I was feeling. Children don't have that ability a lot of times.
Right. So what would it look like for a child to be in recovery?
So in my work, kids that come to me that have experienced a trauma will go into play therapy treatment. So we will do various things with toys and art, even role play. We're using the toys kind of as a way for them to concretely talk about what's happened to them. So for instance, if a child has a trauma that's happened with an ambulance coming, I have an ambulance, and then we'll talk about that through that play. Or they might show it in different ways, through Play-Doh, through art, through different sensory and tactile experiences, talking about the trauma. If you think about sitting with a 5-year-old is, if you talk to them about, hey, what happened, it's going to be very kind of to the point and not much there. So I'm just trying to kind of bring that out a little bit so they process that further, and also give them the words, because a lot of times, 5, 6, 7-year-olds don't even have the words to express the things that have happened to them. And so through the play, they're able to do that. They're actually healing through the play itself.
Right.
So it kind of gives them an outlet to express what's going on inside of them.
Yes. Yeah. And I'll tell parents too that kids don't have to tell me what's happening. It's the play itself that's healing. Dr. Bruce Perry does some work with childhood trauma, and he has a Child Trauma Academy. And he has a model called the neurosequential developmental trauma model that talks about how the brain kind of develops from a bottom-up approach, like from the brainstem up to your prefrontal cortex. So when you are in utero and first developing, those first 3 years of life are really important for brainstem, which is like your breathing, your heart rate, and then as you get a little older, your senses, your touch, taste, all that stuff. Your prefrontal cortex is kind of like your decision making, your problem solving, things like that. So that prefrontal cortex is really not fully developed until a person is in their mid-20s. So for kids, even though they're developing parts of that, it's still kind of, there's gaps in that. They're not being able to do decisions and problem solve. As most parents know, kids aren't always great at. They're kind of still learning and exploring what that's like. So depending upon when the trauma happens for a child, depends on where at in the brain development it's hitting. So you have to be mindful of, like, if a kid has a trauma experience at 3, that's going to look different than a kid who has experienced a trauma at 6.
Right.
And what they have, how their brain encodes that. So what the play does is it's really getting at those primal needs of our brain to work out issues. Most of the toys that you see for infants are really based on sensory experiences. And so a lot of times I'm using that in the play therapy room to kind of go back and get something that maybe they didn't get as a result of the trauma they experienced. So we're kind of working on, it's called a bottom-up approach, where you're working at the bottom of the brain and working your way up. What I do in my treatment with kids is, a lot of times at the very beginning, it's very non-directive on my part. I kind of just give them the room, I set very few limits, and kind of let the kid explore. And I see, kind of like what I talked about, I want to see kind of what's on their mind. What do they gravitate towards? What are they doing with the toy? You know, are they using those toys in a nurturing way? Are they using it in an aggressive way? And I kind of just stay back, kind of track what they're doing. But really in those first 2, 3, 4 sessions, I'm just assessing what is going on. Are they going to play with this in different ways? Depending upon the treatment that needs to be done, depends on how direct I will be. So then we might do something like do an art project where we talk about feelings. Yeah, so for me, since I'm a family therapist, that's kind of a requirement. And I think it's important, because part of what happens in trauma is it affects relationships, which I'm sure y'all talk about that.
Sure, yeah.
So the same is true for kids. It affects their ability to feel safe. So some of the stuff we work on in the trauma work is just working on feeling safe again in relationship with their parent or caregiver. Because sometimes trauma happens, even if the parent has done the best they can, sometimes trauma happens to the child and they don't feel safe. So we have to work on reestablishing that safety, even if that parent wasn't to blame for the trauma. You can look up play therapist all over the world. Just in the United States, you can just type in your zip code and tell how long do you want to drive, and find registered play therapists in your area. And then, you know, I think it's important for anybody to kind of, call and talk to a few people before you pick a therapist. You know, kind of, what is your experience in working with trauma? This is what's going on with my kid. Do you feel comfortable working with this?
So I hope you found Nancy's message to be helpful, but don't forget to check out the description below, because I put links in the description to Nancy and to other helpful resources. Oh, and hey, if you want to join us live for these discussions, then please go check out our Facebook page and like that page, and go click on the events section so that you can see the future Recovery TV live episodes that are coming up. Thanks for hanging with us. See you next time.
Yeah, that's something I developed with my co-owner, Lee May. When I moved to Oklahoma City from Kansas, there was only one registered play therapist in Oklahoma City. So I decided to start up a training program for therapists that were interested in learning more about play therapy, just to bring more qualified play therapists to the Oklahoma City metro area. So we've been doing that for 3 years.